So now we're going to turn to Dr. Montgomery, and you have a very important event to tell us about.
Yes, well, thanks for having me on. And the Montgomery Heart and Wellness is having its 6th annual health summit. And we're excited about our guests this year. As usual, we try to bring in noted speakers and knowledgeable intellectuals from around the country to bring forth basic information and scientific information that's presented to the general public here in Houston. The overall approach or intention is to broaden our minds and insights into how we can improve our health. And the foundation of optimal health is eating a healthy diet. And the foundation of a healthy diet is a plant-based diet. So we're excited. We have our guests include a local surgeon, Dr. Charlton Owl will be speaking. And he's a vascular surgeon here in the Texas Medical Center. He's been speaking at our health summit for a number of years and has been supporting us locally. Dr. Michael Greger, many of your listeners know him very well, is affiliated with Cornell University and does an excellent job with nutritionfacts.org.
Right, it's really a great website.
With lots of scientific information, and I use it a lot myself to support evidence that we use to educate our patients and the like. So he'll be here presenting his information. Also, Dr. Terry Mason, who's the Chief Medical Officer of Cook County Health and Hospital System. And many of you may remember him from Forks Over Knives. He was one of the physicians in Forks Over Knives, and he's a urologist. Then he'll be speaking about the issues of our diet as it relates to men's health. Dr. Doug Lowell is coming again. He was at our 5th annual health summit. He's a psychologist, and he'll be giving some insight in terms of how we are trapped. There's a lecture he does on the pleasure trap, but the psychological impact on our diets and why we eat bad foods. Why does someone who consumes something that they know that's harmful to their health, why do they continue to consume that food? And so he'll talk about those issues. However, no conference is complete without the practical aspect of how do you go from the theoretical concept to the practical aspect. How do you practically prepare the foods? And many of you know Chef AJ from the West Coast. She'll be here presenting and also doing a cooking demonstration and workshop.
Right.
And Chef Babette, who is the head chef of Stuff I Eat in Inglewood, California, will also be here. And these chefs don't just get on stage and prepare food, but they're entertainers. They sing, and Chef Babette will do push-ups and the like.
All right.
But you're in for a big treat. The program is February 21st. It's from 8 a.m. to 3:30 p.m. You can register online. You can go to MontgomeryHeart.com. That's our website, MontgomeryHeart.com. In the upper right corner is a button you can click on and register for the form. So it's not too late. Your listeners can go. It's going to be an excellent program. You'll get a lot out of it. You can also call our office at 713-599-1144 for information about the program. Of course, I'll be speaking this month. It's February, and it's Heart Month. And so as a cardiologist, I'll be talking about issues of heart health and the fact that it's, again, the leading cause of death of men and women in the United States. And so we'll talk about the issues of heart health and how you prevent and reverse heart disease naturally using a plant-based nutrition.
I was just speaking with someone just the other day. She had gone to your clinic, and she was taking your advice, and she really enjoyed the way you talked with her. And it seems to be going very well. So I would recommend Dr. Montgomery to many people out there. And I was very interested about what you were saying about Dr. Lyle, the connection between your diet and your psychological state and your mental capabilities.
Yeah, these foods are addictive. Oftentimes, and I share this with patients that we see, oftentimes patients feel defeated. They're trying to do the right thing, and there's this concept of moderation. There are lots of fad diets out there, and I've yet to see a patient who really doesn't want to do the right thing in terms of improving their health. As I said, oftentimes there's so many things going against them, the environment, fortunately sometimes family members and the like, and these things go against them in terms of doing definitive things, of making definitive steps toward reversing their health. But the other thing that potentially goes against each of us and patients in general is the fact that these foods are addictive. So there's an addictive aspect to these foods. And so the psychological impact, the sociological impact of these foods play a big part in preventing us from reaching the goals that we need to reach in terms of achieving optimal health.
And it's really interesting. It seems like more and more doctors are turning to diet as a solution for their patients. And I have talked to other doctors. There's Garth Davis here in town.
Mm-hmm.
He was on the show and he was telling us that he never learned about nutrition in med school. And many of the doctors in his hospital just don't really think about it at all or talk to their patients at all about it.
Well, that's true. I never learned much about nutrition in medical school either. I think that's, I was telling Colin Campbell a few months ago, we were speaking together, that that's really a good thing because, really that they'd be teaching us the wrong thing. So we'd have to unlearn a lot. So I'm glad I started with a clean slate. So when the truth came, it was easier to apply it. In the political arena, there's, healthcare is very prominent. And so people talk about Romney Care and Obamacare and the different cares. Well, at Montgomery Heart and Wellness, we promote what's called Montgomery Care. And Montgomery Care is quite simple. It's really doesn't require thousands of pages of literature and the like. But basically, we can write it on the back of a note card. And the essence of Montgomery Care is simply this: eat like a rabbit and train like an athlete. If you apply these two concepts to your life, you're going to get the optimal health, and you minimize the needs for medication. It's going to be the most cost-effective and most absolutely effective way to get the best health that you can.
Okay.
And so the eating like a rabbit that's the foundation of your health. You want to eat a plant-based diet, a clean, healthy plant-based diet. And then the next step is that you want to get your body physically fit. And so you want to move and exercise. But nutrition comes first. We have a lot of people trying to exercise, and they'll eat bad food and try to run it off, but that can be potentially harmful. You have to nourish the body, optimize the body's biochemistry and physiology, and then you exercise and put it against a little bit of stress to enhance its physiology even more, and you're going to be much better off.
It can be really hard to change, as everyone knows, especially your diet and your everyday routines and things, and your program helps people do that.
That's correct. We have a number of programs. The Nutritional Bootcamp is our flagship program where individuals come and follow a nutritional detox program. It's a group setting. The lectures are on weekends. There's shopping rounds, food demonstration rounds, cooking classes, and the like. And it's very effective in getting people on the right track and keeping them on the right track. There's also a new program, which is the Food RX program or the Food Prescription program, in which case there are individuals, and it's ideal, not necessarily required, but ideal for individuals who have known health problems or on medication. So they come to the office as a clinic patient, and we put them through the nutritional detox at the same time we're optimizing their medications, in most cases weaning them off medications and the like. That program can be used as part of your insurance coverage, so that's the nice thing about that. And that's one of the things that we're going to be talking about at the Health Summit. So a new program in terms of how you can utilize your regular health insurance through wellness, and that makes it much easier for individuals, because when you're getting your medical care, you really want the foundation of your medical care to be your lifestyle program. And so we've integrated these two things and made it beneficial for individuals.
And you're talking about Montgomery Health and Wellness or also a hospital setting?
Well, it's Montgomery Heart and Wellness. We do this as an outpatient setting, so we try to avoid the hospital. We do have the ability to hospitalize patients who need hospitalization, but hopefully this is usually a short-term process. If someone's very ill and they need to be hospitalized, we can do that. I was in the hospital today doing procedures, and so I work in the hospital and in our wellness center, keeping my foot in both settings, because patients who are in the hospital need to have this approach applied both in the hospital and outside of the hospital.
What about insurance companies and the government? Is there more and more funding for this kind of treatment?
I'm hearing about it, and I read about it, and I think there's a push in that direction. We have to have more programs that are defined. I think there's a gradual step toward consuming plant-based nutrition. We just have to be very definitive. The sicker the patient is, the more aggressive you have to be. And so, our approach with our patients is that we try to get you on a program that's definitive. And so we try to get you on 100% plant-based nutrition and other things as well. So yes, there is a push, and more people are waking up to the truth, if you will.
Yeah, I've been noticing that too. It's really coming out in the mainstream media bit by bit,
That's correct. That's correct.
And it's really a great sign for everybody.
But also, I want to emphasize a special guest speaker we're having is Dr. Kim Williams, who's the president of the American College of Cardiology. He didn't make it on our brochures because we were able to get a late confirmation on him, but this is a big feather in our cap because he's a cardiologist, well respected, and he's vegan, and he actually promotes vegan lifestyle to his patients. And so he is the newly elected president of the American
Wow.
College of Cardiology, one of the two major institutions of cardiologists. And so, this is something that is growing within the area. There was a study done recently, and I didn't bring the details with me, but they looked at the benefits of plant-based nutrition in patients with cardiovascular disease. And in essence, they only reconfirm what we've known in a very large study, that higher amount of fruits and vegetables associated with reduced cardiovascular disease.
Mm-hmm.
And the interesting thing, I was looking at a blurb, and one of the cardiologists who were part of the study, one of the organizers, said, well, the ideal diet is something similar to a pesco-vegetarian diet. And I chuckled, and I said, well, they're getting one step at a time closer to the
right.
truth.
But take out the pesco.
Exactly. Take out the pesco and you're there, But again, it's a process over time, and the sociological change is something that doesn't happen overnight, and so we understand that.
For sure. Well, if you could just present the information one more time, that'd be fantastic.
Yeah, so again, the 6th Annual Health Summit by Montgomery Heart and Wellness is going to be on February 21st from 8 a.m. to 3:30 p.m. Again, you can go to montgomeryheart.com, and in the upper left corner, select the button, and you can register online, or call us at 713-599-1144, and we'll give you all the information. But again, this is a must-attend conference, and we look forward to seeing all your listeners there.
Yeah, it's great. I've really enjoyed it. It's really a great thing, and really top-notch speakers. I mean, you can't do better than this. If you want to learn about vegan health and health in general, this is really a venue to attend. Okay, well, thank you very much.